Good evening, Bahamas. Coming up tonight.
Consultant physicians say they're withdrawing their services. We'll tell you why straight ahead.
The labor director responds to doctors' strike.
Former PLP Cabinet Minister Ryan Pinder weighs in on WTO.
Our News is brought to you by Alive.
Welcome to Our News, and thanks for joining us. I'm Kyle Joaquin. Princess Margaret Hospital has canceled all elective surgeries and reduced all outpatient specialty clinics, including family medicine, medical, surgical, dental, ear, nose, and throat, until further notice. This blow to the public health care system follows the decision by the Consultant Physician Staff Association to withdraw its services over failed negotiations with the PHA. Well, senior physicians warned patients at public health care facilities of difficult times ahead. Jared Higgs reports.
As of today, there are going to be industrial actions, and the public just needs to understand. We hope that they are going to be on our side. We are going to continue to ensure that no one's life is at risk. It has to be a life and death situation, however.
It wasn't long after that announcement was made by Consultant Physician Staff Association President Dr. Loxmi Monroe that the PHA released a statement announcing that it activated its Emergency Operations Center. In addition, the statement announces the cancellation of all outpatient specialty clinics, inclusive of medical, surgical, dental, ENT, eye clinic, and family medicine clinics, until further notice. The announcement by the PHA followed another round of failed negotiations with the CPSA, who say 10 years without a salary increase and the lack of health insurance are simply too much for the senior doctors to bear. The PHA statement also announces that elective surgeries, such as hip replacements, cataracts extraction, and ligament repairs, have also been cancelled until further notice, while all dialysis and chemotherapy treatments will continue to be carried out as usual.
Primarily, all of the elective procedures, those will be the first to go off the book as far as provision of service. Emergency services shall be covered in one way or the other.
Just last week, the CPSA and PHA appeared to be closing in on an agreement that would resolve a dispute surrounding the salaries of senior physicians. According to the CPSA's president, a counter-proposal advanced by the PHA fell short by only settling a deficit of funds owed to senior doctors and failed to adequately increase their base pay. Monroe also acknowledged that it would be unusual for doctors to engage in industrial action and had this response when asked what the action would entail.
You can go slow, you can work the rule, you have sick days that you can call for. Persons can go on leave if they so desire. Okay. But in other words, the services are not going to be pushed in the same manner that they've always been pushed by this profession.
In recent months, senior physicians, junior doctors, and nurses have voiced their concerns surrounding various issues. In September, junior doctors called the PHA out for failing, among other things, to provide maternity benefits for doctors. Prior to addressing the media, senior and junior physicians filled a room in the hospital's library, hashing out their path forward.
There are three unions or three organizations that work under the Public Hospitals Authority that have either gotten approval for strike action or are in the process of seeking that. That in itself, I think, speaks volumes. We all face a common obstacle in trying to get administration to understand that their employees are not indentured servants, but we are partners in health care.
Reporting for Our News, I'm Jared Higgs.
Thanks, Jared. Well, as senior physicians withdraw their labor, junior doctors say they have applied to the Department of Labor for a strike vote.
We have made application with the Department of Labor. There have been some hiccups with that. We are seeking legal advice as to how we can proceed because we've met all the legal requirements to get an approval. That has not been forthcoming. And something as simple as ensuring that junior doctors are paid the legal and constitutional double time for working holidays we have to battle administration for in the 21st century.
Doctors Union President Dr. Melisande Bassett says they are confident in the CPSA's support if her union decides to take action.
When we do get our approval for our strike vote, they will support us as well, because there are many issues that we face that we all share together, and we can't provide the best health care to the public if we are disadvantaged. That's the bottom line, and we need the administration to understand this.
Well, amid strained labor relations in the country, the acting director of labor has urged doctors to proceed with caution when withdrawing their services, asserting that their ultimate concern should be saving lives. With more on this, here's Jillian Gray.
As senior physicians opted to withdraw services today, the acting director of labor is charging them to remember their pledge to save lives.
People have to take into consideration, the life of an individual. Saving lives. When you choose a career as a doctor or nurse, you choose a career to provide health service, you choose a career to help save people's lives.
The Consultant Physician Staff Association received its strike certificate from the Department of Labor weeks ago, but was holding off on industrial action pending negotiations with PHA officials. While they state that life-saving surgeries will not be impacted, senior physicians today withdrew their services. Pinder said while senior doctors are the specialists, junior doctors can do the same work, which may be the answer to providing health care until this matter is resolved.
And they have to be careful. There are other consultants that the government may have to engage during this period. If we don't want that to happen, we wish that it wouldn't happen. Some of these guys ain't pulling their weight no how. Okay? So, at the end of the day, we see what happens. We hope that the hospital is in a position, if the Prime Minister have to, put back on his doctor clothes and Dr. Sanders put back his doctor clothes to help save a life, but the country have to bear with that. They have to bear with that, but I know it's important to save lives.
A leaked version of the CPSA's proposal shows that senior physicians are proposing that their base pay increase by $50,000 over a 5-year period, which would increase their payouts by up to $15 million.
The negotiations was not at a stalemate. PHA asked them to come back to us with another proposal because this will be off. You say you're like, we'll be off, okay, come back with something else. That is the art of negotiating. My information is, when they were at the table last week, the PHA gave them a counter proposal to their proposal, which they did not accept. The PHA asked them to give them back another proposal. That's the art of negotiating. You don't ever get exactly what you want, but you have to continue to negotiate to try to be as reasonable as possible, bearing in mind the country's financial position.
Now, Pinder said the Department of Labor will continue to help CPSA and PHA in their negotiations. As he says, their responsibility is to ensure industrial harmony. Reporting for our News, I'm Jillian Gray.
Thanks, Jillian. Well, former Financial Services Minister Ryan Pinder says he does not believe the Bahamas is ready to join the World Trade Organization based on the current state of the economy. Jasmine Brown has that.
Pinder participating in a Bahamas Chamber of Commerce panel this morning where he made his position on WTO clear.
So I think without a clear definition of what our economic makeup is, how we're going to prepare the economy, how we're going to prepare the participants in the economy for the drastic changes that we're going to see as part of WTO session, I don't know if we can withstand the initial shock to last the 5 years to see the prolonged growth that is being forecasted.
Pinder, who also had responsibility for trade under the last Christie administration, also led the former government's WTO talks. Since leaving office, he has called for a strategy that protects the sector by preserving or carving out tariffs on rival imports from the negotiations. Pinder, who previously supported the WTO, now says it is not the right time for WTO accession.
My point is we have more control in our negotiation and the implication to the vulnerability of our economy if we're dealing with one or two countries rather than the entire makeup of the WTO. So I think there's been a shift, certainly from a WTO accession process and trade marketplace to a more multilateral approach.
Since coming to office, the Minnis administration has been on an aggressive push for the Bahamas to become a full World Trade Organization member by 2019, a process which began in 2001. Current Financial Services, Trade and Industry Minister Brent Simonet admitted in April that it will not be easy, but he insisted the government is determined to meet that deadline. Simonet also has said the government will no doubt have to make changes to the current fiscal regime. Pinder says talk is cheap and insisted there will be market vulnerability.
Although the government has said they're going to pursue a peaks and valleys negotiation strategy, we don't know what those peaks are. We don't know if the peak is going to drop from 65% rate to a 45% rate and what the effect that's going to have on the marketplace. And so I would ask that there a little bit more transparency with respect to those negotiations, with respect to the specific rates.
Reporting for our News, I'm Jasmine Brown.
The Minnis administration is bracing for a reduction in revenue due to an expected decrease in customs duty following the Bahamas' accession to the World Trade Organization, according to Finance Minister Peter Turnquist. He addressed a WTO power breakfast hosted by the Bahamas Chamber of Commerce and Employers Confederation this morning.
So we anticipate that there's going to be reductions in the customs duty. We don't see that as a bad thing. We believe that we have built in some safeguards and some cushion to absorb that.
In September, the government's chief WTO negotiator, Shivago Lang, insisted the Bahamas is in good shape to lower its average tariff rate to the 15% demanded by the WTO. Turnquist said today government is carefully planning the way forward as the Bahamas is set to join the WTO next December.
We anticipate that we will have some reductions in revenue as a result of customs duties. And if you look at the makeup of the revenue today, you will already see that the revenue from customs and border taxes is already reducing as a percentage of the overall. So this is all being planned into our fiscal strategy going forward. No doubt that if you look again at the projections, we're anticipating that with the increase in the value-added tax last year, that we're going to be able to, after paying some of these arrears that we've been talking about.
Still to come, the teachers' union agitating for government to address ongoing issues at C.H. Reeves. Plus, why the PLP chairman says government is tone deaf on labor issues. Stay tuned.